Hi, it's Patrick from intensivecareathome.com.au, where we help long-term ventilated adults and children with tracheostomy to improve their quality of life, and where we also help hospitals and intensive care units to save money and resources whilst providing quality care. In last week's blog, I wrote about how to provide more privacy and dignity for long-term ventilated adults and children with tracheostomy. If you haven't read the blog, you can check it out here by clicking on the link. In this week's update, I want to talk about the 5 reasons why offering additional intensive home care services is a massive advantage to intensive care, long-term ventilated adults and children and their families. I'm a strong believer in and advocate of home care, irrespective of the specialty or the discipline within healthcare. Consumer-centric home care models should be the norm in this day and age. I also believe consumer-centric means to bring healthcare to the healthcare recipient or consumer, and that of course means to offer healthcare in somebody's home. If we don't offer healthcare outside of current clinical paradigms, we might miss the boat and health consumers, their families and hospitals in Australia miss out on developments that have been massively successful in other countries for more than a decade now. On top of that, there are 5 distinct reasons why even in a specialty area such as intensive care, home care for long-term ventilated adults and children with tracheostomy is bringing massive advantages for all parties involved and create a win-win situation. Number 1. Improved quality of life and or quality of end of life for long-term ventilated adults and children with tracheostomy. Number 2. Peace of mind for long-term ventilated adults and children with tracheostomy and their families, because they know that they can be safely looked after in their own home rather than in a sterile clinical environment. Number 3. Peace of mind for intensive care units and hospitals, because they know that they don't have to worry about their long-term ventilated adults and children with tracheostomy occupying an expensive intensive care bed, and yet they still get the best possible care. Number 4. An empty bed in intensive care that can be used for more acutely unwell patients and admissions. And number 5. A more cost and resource effective model of care that is also far more consumer-centric and provides a win-win situation for all parties involved. Can you think of any other reasons why intensive home care services are advantageous? Can you think of any reasons why they may not be advantageous? Leave your comments on the blog. If you are a health professional in intensive care and you think you know a long-term ventilated adult or child with tracheostomy and their family who would like to improve their quality of life and or their quality of end of life in their own home rather than in intensive care, even if it's to go home for a few days, and if your organization would also like to save money and resources along the way, or if you simply have any questions, give us a call or simply send me an email. This is Patrick Hutzel from intensivecareathome.com.au, and I'll see you again in another update next week.